Gestational diabetes is an endocrine disease. Look at this picture, shows that glucose intolerance during pregnancy. Introduction. Gestational diabetes mellitus is a type of diabetes that develops during pregnancy and typically resolves after childbirth. It is characterized by high blood sugar levels that requires management to ensure a healthy pregnancy for both the mother and the baby. A definition. Gestational diabetes is defined as glucose intolerance that begins or is first recognized during pregnancy. It is distinct from pre-existing diabetes, which is present before pregnancy. Types. There are generally two types of gestational diabetes. One, A1 GDM. Gestational diabetes that can be managed through diet and exercise alone. Two, A2 GDM. Gestational diabetes that requires medications, insulin or oral hypoglycemics, in addition to lifestyle modifications. Causes. The exact cause of gestational diabetes is not known, but it is thought to be related to the hormonal changes of pregnancy and their impact on insulin function. These hormonal changes can lead to insulin resistance, where the body cells do not respond well to insulin. Risk factors. 1. Age. Women over the age of 25 are at high risk. 2. Weight. Being overweight or obese increase the risk. 3. Family history. A family history of diabetes can raise the risk. 3. Previous gestational diabetes. Having had gestational diabetes in previous pregnancy. 4. Ethnicity. Certain ethnic groups including African Americans, Hispanic, Native Americans and Asian are at high risk. 5. Polycystic ovary syndrome. Women with PCOS are more prone to developing gestational diabetes. Complications for the baby. The macrosomia, large baby, to birth injuries due to large size, hypoglycemia after birth. 4. Respiratory distress syndrome. 5. Increased risk of obesity and type 2 diabetes later in life. For the mother, 1. Pre-eclampsia, high blood pressure and organ damage. 2. Increase the risk of cesarean delivery. 3. Higher likelihood of developing type 2 diabetes in the future. Pathophysiology. During pregnancy, The placenta produces hormones that contribute to insulin resistance, making it harder for the mother's body to use insulin effectively. As a result, blood glucose level rise. If the pancreas cannot produce enough insulin to overcome this resistance, gestational diabetes develops. Signs and symptoms: 1. Often asymptomatic and detected through routine screening. 2. Excessive thirst. 3. Frequent urination. 4. Fatigue. 5. Nausea. 6. Blurred vision. 7. Recurrent infections. Diagnosis: 1. Screening test, typically done between 24 and 28 weeks of pregnancy using 2. Glucose challenge test (GCT). A preliminary screening test involves drinking a glucose solution followed by a GCT blood sugar test. 3. Oral glucose tolerance test. It's are abnormal. This test involves fasting, drinking a glucose solution, and multiple blood sugar tests over a few hours. Nursing diagnosis: 1. Risk for imbalanced nutrition, more than body requirements. 2. Risk for unstable blood glucose levels. 3. Risk for infection. 4. Deficit knowledge related to disease process and management. 5. Anxiety related to potential complications. Management and treatment: 1. Lifestyle modifications, diet and exercise are first line treatment. 2. Blood sugar monitoring, regular monitoring to ensure levels remains within target range. 3. Medication, insulin or oral hypoglycemic agents if blood sugar levels are not controlled with lifestyle changes. 4. Fetal monitoring, regular ultrasound and non-stress tests to monitor fetal growth and well-being. 5. Education and support, teaching about diet, exercise, blood sugar monitoring, and medication administration. Psychosocial medicine: 1. Emotional support for anxiety and stress related to diagnosis and management. 2. Counseling to address concerns about pregnancy complications and future health risk. 3. Support groups or resources for women with gestational diabetes. Prevention: 1. Maintaining a healthy weight before and during pregnancy. 2. Eating a balanced diet rich in fiber and lower in processed sugars. 3. Regular physical activities. 4. Early prenatal care and screening for high-risk individuals. In conclusion, gestational diabetes is a common condition. If properly managed, can lead to a healthy pregnancy and baby. Early diagnosis, effective management, and ongoing support are critical in minimizing risk and ensuring positive outcome for both mother and child. Education and lifestyle modifications play a crucial role in prevention and management, making it important for healthcare providers to offer comprehensive care and resources to affected women. Thank you. Have a nice day.